If you've recently been vaccinated against COVID-19, you're probably feeling pretty relieved that you're protected from getting sick. However, you might also have a lot of questions about what is and isn't safe, like whether you can visit your loved ones or go on a trip. You might also be wondering about side effects that may develop after the shot. Don't worry, we're here to help. We've gathered up answers from the most trusted sources, so you can make your post-vaccine decisions with confidence.
What does it mean to be fully vaccinated against COVID-19?
You're fully vaccinated 2 weeks after your last dose. After you receive the COVID-19 vaccine, your body has to build up an immune resistance to the virus. This immunity is complete about 2 weeks after your second dose of the Pfizer or Moderna vaccines, or 2 weeks after your single dose of the Johnson & Johnson vaccine. In the meantime, get plenty of rest while your immune system does the hard work, and keep taking steps to protect yourself and the people around you.
Should I wear a mask and social distance after I'm vaccinated?
No, you don't need to wear a mask once you're fully vaccinated. As of May 2021, the CDC has stated that you do not need to wear a mask or social distance indoors or outdoors if you've been fully vaccinated. However, you do need to follow the laws and guidelines in the areas you live, work, and frequent, and some of those might require masks and/or social distancing. For instance, you still need to wear a mask when using any form of public transportation. Additionally, if you are immunocompromised, you may want to continue wearing a mask and social distancing to protect yourself. If you're fully vaccinated, you have a very, very low chance of contracting COVID-19. If you're not fully vaccinated, you need to continue wearing a mask and social distancing.
Is it safe to visit friends and family after COVID-19 vaccination?
Yes, it is. Once you've been fully vaccinated, the great news is that it's likely safe to gather indoors with other vaccinated people, even without masks. The CDC has also said that it is safe to get together with unvaccinated people for both indoor and outdoor gatherings once you are fully vaccinated. Just to be safe, mask up if anyone is at a high risk of developing a serious case of COVID-19, like if they have cancer, heart conditions, coughed, or are pregnant. Also, take other precautions like washing your hands frequently, avoiding touching your mouth or nose, and cleaning high-touch surfaces throughout the day.
Can I go to a restaurant after I get fully vaccinated?
Yes, you can. The likelihood that you'll get COVID-19 while eating in a restaurant is pretty low once you're fully vaccinated. Experts are now saying that you can resume normal activities, such as dining indoors at a restaurant, without wearing a mask or social distancing if you're fully vaccinated.
Can I travel after getting the COVID-19 vaccine?
Yes, you can. Once you are fully vaccinated, you can travel both domestically and internationally. However, you must wear a mask, social distance, and wash your hands frequently. Get tested for COVID-19 within 3 to 5 days of returning home from your travels. If your test is positive, self-quarantine. If you are traveling internationally, check the laws and guidelines at your destination and make sure to understand and follow them. If you travel outside of the United States, you must show proof of a negative COVID-19 test no more than 3 days prior to your return to the US. You don't need to quarantine before or after traveling unless you have symptoms of COVID-19, or your destination requires it.
Can you spread COVID-19 after getting vaccinated?
It's too early to know for sure, but you're probably less likely to transmit it. It's possible that if you're exposed to COVID-19 after you're vaccinated, you'll still be able to transmit it to others, even though your immune system will keep you from getting sick. However, early research is pretty encouraging. Getting vaccinated does mean you're less likely to get infected, so you're less likely to infect other people. Some researchers have found early indications that people who are fully vaccinated carry a lower virus load if they do get infected, which is likely associated with a lower risk of spreading the illness. Some evidence also suggests that people who are fully vaccinated are less likely to be asymptomatic carriers of COVID-19.
How long does protection from a COVID-19 vaccine last?
That's unknown, but probably for at least a few months. The long-term effectiveness of the COVID-19 vaccine isn't known yet. Some experts believe we may need to get a yearly vaccine, just like we do with the flu. So far, We know that people who receive a vaccine are protected from COVID-19 for at least a short time, but since the vaccines were just developed in the past few months, researchers don't know exactly how long that period will be.
Will you test positive for COVID-19 after getting the vaccine?
No, because the vaccines do not contain the COVID-19 virus. All of the current vaccines work by teaching your body to fight against the protein that coats the outside of the COVID-19 virus. Your body does produce copies of that protein and builds immunity to that, but you're not replicating copies of the actual virus itself. Therefore, getting the vaccine will not cause you to get a positive COVID-19 test. However, since you do create antibodies that help you fight COVID, you may get a positive result on a COVID-19 antibody test.
Do I need a COVID-19 test if I'm vaccinated?
In most cases, you'll only need to be tested if you show symptoms. Even if you're exposed to COVID-19, you likely don't have to worry about quarantining or taking a COVID-19 test if you don't feel sick. However, if you do start to show any symptoms, quarantine yourself and visit the COVID-19 testing site, just like you would if you weren't vaccinated. One exception to this is if you live in a group setting, like a group home or a correctional facility. In that case, if you're exposed to COVID-19, get tested and quarantine for 14 days.
Will the vaccines work against new variants of COVID-19?
They're probably effective against most COVID-19 variants. It's still too early to know for sure, but early evidence shows that the current vaccines will likely protect people against a wide variety of COVID-19 strains.
What are the most common side effects of the COVID-19 vaccine?
You might have flu-like symptoms or soreness in your arm. When you get the vaccine, your immune system kicks into high gear. That can give you mild flu-like symptoms. You might feel tired or get a headache, muscle pains, a fever, or chills. You might also get pain, redness, or swelling in your arm where you received the shot. Some people develop a red, itchy, or sore rash on their arm after getting the vaccine. This can show up anywhere from a few days to more than a week after the shot, but it usually clears up in just a few days. Very rarely, some people have a severe allergic reaction to one of the vaccines. Most vaccine providers will have you stay on site for 15-30 minutes after you get the shot to make sure this doesn't happen.
How can I reduce the side effects of the COVID-19 vaccine?
Ask your doctor about medicines for discomfort. Most of the side effects of the COVID-19 vaccine are mild and will go away in a few days. Over-the-counter pain relievers like ibuprofen, aspirin, or acetaminophen can help with that. If you get a fever, drink plenty of water and dress in cool clothing until your temperature comes down. If you get an itchy or painful rash on the area where you got the shot, you can take an antihistamine or a pain reliever. You can also place a clean, wet cloth over the area to help ease any pain. Call your doctor if your side effects become worse after a few days. If you think you're having a severe allergic reaction, call emergency medical services immediately.
Should I get the second shot if I have an allergic reaction?
No, not if the reaction happened suddenly or was severe. If you have a severe allergic reaction or you react with hives, wheezing, or swelling within 4 hours of getting the first shot, don't get a second shot of the vaccine. If you had an allergic reaction to one of the mRNA vaccines, either Moderna or Pfizer, don't get the other mRNA vaccine, either. A severe reaction is one that had to be treated with epinephrine or in a hospital. If you had a reaction to the first dose of a mRNA vaccine and you can't complete your second dose, talk to your doctor about whether you need to get the non-mRNA vaccine, Johnson & Johnson, in order to be fully protected. It's okay to get the second shot if you develop a rash. If you noticed an itchy or swollen rash at the injection site, you might be concerned about getting a second shot. Fortunately, there's no evidence that this will lead to a severe reaction when you get the second dose of your vaccine. However, to tell the person who gives you your vaccine about it, they might advise you to get the shot in your other arm just to be safe.